Extreme plastic surgeries that should not be legal. When is beauty or cosmetic augmentation a choice versus when is it a disorder? I'm actually here with Dr. Gary of City Facial Plastics. He's a double board certified expert, a facial plastic surgeon, and he even speaks a lot about his own journey with hair loss and alopecia as an expert. And Gary, I'm so excited to speak with you about plastic surgeries that should be illegal.
Yes, Cassandra, this is so much fun. I'm glad we're doing this. I think there's a lot for people to learn here.
You're a double board certified facial plastic surgeon. You're also an expert when it comes to hair transplants, hair loss, everything as an ENT. Tell me a little bit about how you got into plastic surgery and some of the things that you no longer do, such as buccal fat removal.
Yeah, sure. So my interest started with head and neck surgery and head and neck anatomy, and I've always had this interest in being creative about things and approaching different problems in creative ways. So as I was introduced to facial cosmetic surgery, that's what really got me super excited about a career in facial plastic surgery, and then ultimately also in hair transplant surgery. And they complement each other great. And I love how psychology plays into people's decision making for elective cosmetic surgery, and how it really, for the most part, can change lives for the better. I do have concerns, as our field gets more and more popular, people doing things for the wrong reasons, doctors doing things for the wrong reasons. The purpose of my YouTube channel is really to be honest with people and to discuss these very matters and how we can stay safe and still, optimize our looks over time.
Dr. Gary, something you just mentioned is that, augmentation, aesthetics, and plastic surgeries are becoming more and more common. I think in 2020, there were about 15 million people who went in for elective or cosmetic surgery versus about 6 or 7 million that did reconstructive. So I think that having that knowledge and education, and again, understanding when is this a choice and a beauty standard versus a disorder, it's super important. And a huge disclaimer to anybody watching, Dr. Gary and I are going to be going over specific procedures, maybe looking at specific celebrities, but this is not meant to attack anyone who has had these, considered these, or any of the celebs mentioned. It's just important for us to discuss so that we can have open discourse, so that we can learn along the way, and we can have these conversations to help us be healthier and more aware. So just want to make sure that that's clear.
It's not such a clear divide sometimes between what is classified as cosmetic surgery versus reconstructive surgery. In my mind, oftentimes those two are very much interconnected. You want to try to minimize any cosmetic problems, making sure to not distort the anatomy so that you now have issues with speech, with the way you eat, because your lip is pulled up too high. So it's not just about the cosmetic, it's very much about the functional always, at least the way, I run the practice, but the way that things ought to be. But you have to always keep safety and function in mind. And that, will come up later as we talk about some of these examples that we have today, because function isn't always at the forefront of some of the things people are doing, and that becomes a problem.
Yeah, like you said, function first. It even brings us to who we spoke about on your channel, which everyone needs to watch. We spoke about Michael Jackson, and he said that, his rhinoplasty or nose surgery helped him hit higher notes and breathe better. So was it aesthetic or was it functional? And there is this huge distinction between what's illegal / unhealthy for a patient versus what is beneficial. Before we jump into some of the specific procedures that many people get or that many people take to the extreme, you actually did a really interesting video speaking about why you don't do buccal fat removal anymore. What is the 60-second version? And then if people want to watch the entire version, it's available on your channel. But why did you decide to stop doing a buccal fat removal?
So yeah, in the video I give 6 reasons, and not to recite all of them. Basically, there's a type of fat called the buccal fat. It's in our cheeks here. It's deep-seated fat. It's not the fat that's just under the skin. If you have a buccal fat removal surgery to make your face look less round, you're kind of getting rid of the fat that you'd keep later in life when you actually want to maintain some degree of fat in the face to not look too gaunt and thinned out. There are very few people who are much older that want that surgery. So usually it's a surgery done for patients in their 20s and 30s. The concern is that later on those patients can very much regret having had that done, because now they're sunken in and the rest of the fat is going to start to depreciate over time. And as that happens, now they've lost the only fat that they would have otherwise kept had they not done that surgery. So to me, it just didn't make sense to put people through that and have them potentially regret it down the road.
Dr. Gary, introducing our scale of plastic surgeries from permissible to preposterous. Where do you think buccal fat removal falls on that scale?
Right. I would put buccal fat at 7.
Ooh, okay. A little more towards preposterous. Okay, a secure 7. I like it.
There are some older patients who have real buccal fat prolapse. They're going in for aging face surgery and you're doing a facelift. Oftentimes you can target the buccal fat pad as part of the facelift surgery. So there are caveats to buccal fat removal, but I'd still put it a little closer to preposterous.
Yeah, I get you. Speaking of our first official plastic surgery and whether or not it should be illegal, there is the Balkan Barbie. This is someone who has gotten lip fillers past a certain extent. She's opened up about having over 26 procedures done to her lips, and I think she just had the 27th done this December in 2021. When looking at her lips, they are obviously much larger than we normally see. As a facial plastic surgeon, what do you think of this sort of augmentation? What do you think, is this even beyond, Juvederm and Restylane? Like, what even is this? Do you think it's legal, and do you think it should be legal?
Wow, there's a lot to untangle here. First of all, this is a cosmetic procedure, but I wouldn't classify it as surgery per se, unless she's also had some kind of lip surgery, which is possible. It seems like she's been getting a lot of these injections, and I don't know what they're injecting her with. Most of us these days are using hyaluronic acid-based fillers, like you mentioned, Juvederm, Restylane, but there are still people who use silicone, and I don't know if you can call this, if you can say that it's illegal. It's just it doesn't make any sense. If you look at these lips, they're just so out of proportion to the rest of her face. Also functionally, I just can't imagine her having an easy time eating properly or speaking properly with lips that look like that. I mean, it's hard to control your actual lips. Like, point of the lips is to help us with speech, with starting the bolus of food, taking the food into our mouths. And here you have something that becomes very difficult to control because they're like sticking out of your mouth and occupying, almost like a fourth of her entire face. I mean, it's just so extreme. I don't know how any provider could have thought that this was a good idea.
And I know that Andrea boasts that she has like the biggest lips in the world. And I'd actually love to know, Dr. Gary, just from kind of looking at her, does this look like repetitive fillers that have stretched the lip tissue? Or do you think that there is some sort of an implant? Or do you think this can all be done with, injections and filler? Is that something that you would ever do or that other facial plastic surgeons would ever consider?
Yeah, so I'm not seeing any obvious scars. I'm just seeing like over-injected lips, and this is something that can be achieved with hyaluronic acid-based filler. Like, I think she mentioned 27 injections, so 27 cc's of filler could do this. It's just sad because her lips will never be normal. Some people think that you can just dissolve this away, and I think that's sometimes one of the problems is that when we talk about non-surgical procedures like this type of lip injections, it's oftentimes sold or marketed as this reversible type of injection. But we know with MRI studies that have been done that lip filler, any kind of filler that's HA based, really stays in the face and the body for extended periods of times. It can be decades. And then reversing it with hyaluronidase, which is the substrate that's used to break down the filler, can have other repercussions like thinning out your skin and your subcutaneous tissues. Everything has to be done, I would say, in moderation. And this is a case where you have an extreme situation where someone's almost trying to go for a world record. But the world record is something that, is dangerous. But as a facial plastic surgeon and someone who cares about the classic side of it and making sure that people can, function properly, I mean, this kind of hurts to see because it's such an aberration.
And like you mentioned, even with like hyaluronidase, to kind of break down the hyaluronic acid, or even if you had an implant that you got removed, you have that stretching of the skin. And with that much filler, could you have vascular occlusion? Now, this is a question for you as a FPS, but you have the trigeminal nerve, you have these muscles that actually have to, support the skin and support the facial structure. Do you see lips being overfilled like this ever causing issues with some of those, sensory and neurological components?
It's a good question. I think that in the lips, the only thing that could really happen as far as nerves go is you could have some sensory loss if you're putting a lot of pressure on the small little sensory nerves in the lips. So potentially the feeling that you have to your lips could change. The stretching of the skin for sure could be irreversible. Also scar tissue.
And just looking at her, she's not the traditional standard of beauty, but I have seen her even speak on Instagram. She's like, I like the way I look. I don't give a F about whatever anyone else says about me. Where is that distinction between someone feeling beautiful in their own skin and, like you said, almost, this performance or this body augmentation for show versus when is this, a disorder? When is this causing issues to eating, to sensory? Where do you think this falls, and would you ever perform this?
Yeah, I think it could be all of the above. I think, like we said, extreme case and potential for functional problems, and not something that most people would ever want, and not something that I would ever perform for someone. The sad part is that there always will be someone who will for the right price, and it's sad, and that's one of the problems in the aesthetic industry today. Not everyone knows how to say no.
True. There are some people who, come into like a dermatology clinic and they say, I want Juvederm, like I want XYZ. It's important for the doctor or the injector to have that conversation with the patient to understand their goals. So looking at our, surgery scale of permissible to preposterous, where do you think this one falls?
It just doesn't sit well with me. I don't like where she's going with this. I don't think she'll stop with just lips only. So I would put her situation at closer to a 9 on our scale. I just think it's so different from just our standard understanding of beauty, and I do worry about the health impact. It's not a good idea, so I don't like it.
I was gonna say as well, for me, I think I put this at like a 9.5 out of 10. Like aesthetically, it's not what we traditionally see as beautiful or as aspirational. But this is definitely not something that people should aspire to for health and safety and, appearance. And
for sure,
if you're trying to make a statement, it's definitely going to work. Speaking of more body modification, body modification can be done for religious or cultural purposes. Things like piercings, 50% of Americans have a tattoo. But the question is, when is body modification taken to an extreme? There's one case of the Black Alien Project where a 33-year-old Frenchman decided that he wanted to become a black alien. And he's done things to his entire body, including removing fingers, but we're going to mainly talk about his face. He's had his upper lip cut off, he's had his tongue divided, and he's had a lot of these procedures to look a specific way in his transformation into this black alien, including, getting tattoos on his eyeballs, etc. Now, this is obviously much more extreme and not something that we see every day, but it comes down to the conversation of, is this a form of art or is this a form of disorder or concern? Dr. Gary, when looking at this Black Alien Project and this presentation specifically in the facial area, what are some of your thoughts on tongue splitting, on removing this portion of the lip or on some of these extreme tattoos and pigmentation?
There's something almost like, I almost got queasy, and like it's weird maybe saying that as a surgeon, but it bothered me that someone would deliberately do these things that otherwise I've seen people with rhinectomies, with ears removed, with tongues cut out for cancer surgery. I've done those surgeries. And you do that to like save someone's life because they have a cancer, and if you don't do it, it could spread throughout their body. So to see someone like a black alien doing these procedures to himself or having some sort of, I don't even know who does these surgeries. I don't think it was a licensed provider, but I'm not sure. It's just so disturbing to me, honestly, that it was hard to just like look through his page. Because going back to this, what we said in the beginning about function and preserving function first and foremost, this is like the exact opposite. This is a total mutilation of your body, and you're removing function. There's a beauty to these functional attributes and what allows us to live and have a good quality of life. Destroying that to just look a certain way for some very twisted reason just doesn't sit well with me at all. And to do all this, why? Like, I just don't get it, because he wants to look like an alien. It's beyond me. I mean, this is beyond our scale of 1 to 10, preposterous. I mean, this is like a 30 in my book. I know that there's a subculture of body modification, but I think clearly this guy has taken it to some very, very major extreme. And the whole reason of becoming a doctor is like to help people, and you're always just thinking like, how do I help this person? How do I make things better for them? And this is like just complete opposite. It's just mutilating the body, just destroying things that were given to you that are meant to help you. So I don't know, I have a very, I guess, tough take on this.
Yeah, and he says that he's only about 34% done into his transformation of turning into an alien. And you're right, just when looking at the function of this, it's like how people present themselves for religious or cultural reasons is different. But like you said, removing, the tip of the nose, you're opening yourself up to more infection. Like you said, right. The ear, auditory systems, making sure that we can hear, also preventing, infection, spiders, bugs from crawling into these orifices of our face. And it really makes you question, is this, a personal choice and modification, or is this some sort of a disorder or a need to go to the extreme for some sort of underlying psychological issue? Speaking on kind of the other side of extremes, this is something that we might not look at as traditionally beautiful. Now, the antithesis of that is someone who loves K-pop, social media culture so much that this person has modified themselves to actually look Korean or change a race into what is seen as the beauty standard. This one person, who is an influencer, has undergone over 18 plastic surgeries to look like one of his favorite K-pop stars. And it's to the point where he's actually opened up about basically changing his race or ethnicity, and he now identifies culturally and ethnically as Korean. I would love to have a conversation about the difference between cultural appropriation and appreciation, and 18 facial plastic surgeries, changing someone's race aesthetically. What are your thoughts as a facial plastic surgeon about this?
A lot to unpack here as well. You could say that's similar to the black alien, who I guess that gentleman maybe loves aliens or what they represent. Oli London seems to love K-pop and what that represents and wanted to turn himself into that. I think it's another situation where you have distortion of the normal. And I think he takes from like this whole idea of like that you can feel a certain way and not be born a certain way and then want to change your body, your face into someone else, and gets into a lot of, I think, gray zone. It's not so black and white. But what worries me is when we take something like transgender surgery that's done for a very specific reason because of genetic underpinnings and people being born feeling a certain gender and not having that always be manifested on the outside. Transracial is something totally different, and I don't think something that we ought to just accept as the norm. I don't know, so I'm trying to keep an open mind to transracial, but I think it's important that we distinguish it from something else like transgender surgery, which is very, very different. So I don't know. It's not an easy answer here.
No, Gary, I agree, and it almost sounds like it's this distinction between what is the actual surgery or cosmetic augmentation, and then what is the societal impact, right? Gender affirmation surgery is different than transracial surgery, but as you mentioned, there are so many people with beautiful, large noses that are more downturned or larger. Whether we look at people who maybe are from the Middle East, from India and Pakistan, Iran, etc., who, are told by certain plastic surgeons who maybe have a Eurocentric standard of beauty that their noses need to be smaller. And when we look at Ollie, the fact that he's going backwards, it might be untraditional to some people, but it's like, well, that is an ethnic feature of a specific race that is beautiful. Now, the question is it a problem when he says, well, now I'm transracial? I didn't grow up with the same stigma. I didn't grow up with the same issues. What's the difference between eating a food, speaking a language? And then when is that, something that is done by a group that has privilege, and instead of being ridiculed by those things, like people of that culture were originally, subjected to all of a sudden being appreciated for that or gaining popularity over that. Some sources are saying that he spent over $150,000 on these surgeries. It looks like, some sort of filler. Definitely looks like there could be, something in the cheeks, maybe some forehead, definitely some eyelid stuff. I would love to know what you think of his actual facial modifications, maybe what has been done.
In a way, you could, I guess, make an argument that that's like showing respect for another culture and a love for another culture where you're sort of becoming that. And he's going maybe to an extreme and saying like now he feels like he's that culture, which I don't know. But from a surgical perspective, I'll say, when I look at where he's arrived to, and I think back to my recent video that we did on Ariana Grande and her surgeries, I definitely see some connection there in the sense that with the lifting that she's had at a young age, in a way there's certain kind of Asian elements to that, and I'm seeing him having some similar features. How is her surgeries, having had that and spending as much money as she's done, how is that any more right or okay than what he's done? So I'm trying to kind of keep an open mind to it. On the surface it seems strange and odd that he would try to become Korean and say that I'm transracial, but there's a lot of surgery that's being done and creating that same appearance without people stating that that's the reason why they did it or that's what they wanted to look like, but they might still look that way just because of the types of surgery. And always coming out and saying like this is why I did it and this is what I was going for, but in a way I see a lot of similarities. Yeah, when is it like appreciation, like you said, and just showing your love for culture versus appropriation? I guess you're the dominant race and you're just taking qualities from other races and you're still in control of how things are perceived. I mean, I guess that's a whole other discussion.
Yeah, looking at our scale of permissible to preposterous, where do you think his surgeries lie? I want to give it maybe a 5. I really do. Yeah, the more I think about it, when I first heard about his story, I did also, like everyone else, sort of like say, wow, like what is that? Why would someone do that? And I think it seems to be coming from a good place. When I look at this, I think that I would rate it somewhere between like a 6 and a 7. And I think that that's, again, not necessarily based on the exact procedures or the way it looks, but more about, 18 surgeries. Is that excessive? Is this enhancing one's features, or is this, going a little bit too far and even diving into body dysmorphic disorder, right? Or not being happy with oneself. Is enough ever going to be enough? When it comes to permissible to preposterous, I definitely think that there is a spectrum. And speaking of that, we actually spoke about people like Michael Jackson, Jeffree Star, a few other people like Catwoman on your channel. And if anyone is not subscribed to Dr. Gary, sunscreen and subscribe, in the words of Dr. Dre. Get your priorities straight. Dr. Gary, thank you for speaking also about hair loss and alopecia. I recently opened up about my hair loss journey, and your channel has been such a source of knowledge and inspiration. So fix your priorities. Link is right there. Dr. Gary, thank you so much for joining us. Any final thoughts? If a patient came to you asking for a more extreme surgery, what are the words of wisdom that you would impart upon them?
I would really talk to them about the potential downsides and the consequences of those decisions. And I really think that people ought to weigh the risks and the potential benefits. And if the equation really is such that the risks are so much higher than the benefits, then it's better not to do that surgery. So reasons for wanting surgery are important, and I think every surgeon ought to try to extract that information from patients, and that requires longer consultation times that are more than 5 minutes. So I tell patients that if your doctor is just wanting to spend a few minutes with you, then that's the kind of the quality that you're getting.
Very true. Well, Dr. Gary, thank you so much. I will see you on the internet, and everyone else, remember to stay hydrated, reapply your SPF, and be beautiful both inside and out. We'll see you on the internet.
Cool.
Bye, guys.
Bye-bye.